If it is the case that we should not harm others, then we should practice respiratory hygiene to prevent spreading a potentially harmful infection to others. The risk of harm that you pose to others is variable. It may be low or higher, and this variation corresponds proportionally with your ethical obligation to mitigate that risk, which in turn corresponds proportionally to the measures you should take to mitigate that risk. For respiratory hygiene, the risk you pose to others is your risk of being infectious with a contagious respiratory illness. And the greater that risk is, the more efficacious measures you should take to mitigate that risk, such as prescribed by this protocol, utilizing this mitigation toolkit, according to which, if your risk of being infectious is low, such as when you feel fine, your ethical obligation to mitigate your risk is correspondingly low, and thus you ought to take simple measures such as covering your coughs and sneezes and washing your hands, which are ethical norms even if you are probably not infectious. If your risk of being infectious increases modestly, for example, if you think you might have the flu but you're not entirely sure, your duty to mitigate increases such that you should consider utilizing more effective measures, such as wearing a mask, because a mask can suppress infectious respiratory effluent more effectively than cough etiquette. If your risk of being infectious becomes high, for example, if you believe you have the flu, your duty to mitigate becomes high, such that you must deploy maximum mitigation efforts, including hand hygiene, masking, and social distancing if you cannot avoid being around others. But optimally, you should stay home, a high-cost but highly effective measure for mitigating the risk of harm you pose to others when you are probably infectious. This ethical framework for respiratory hygiene is more descriptive than prescriptive, which is to say, by and large, it describes how respiratory hygiene has been practiced, more than declaring anew how it ought to be practiced. While masking has not been common in the West, many Eastern cultures have included masking in their respiratory hygiene toolkits.